latest edition of the 3 healthcare headlines you need to know from Tallahassee. My name is Fraser Cobbe. I'm the director of a number of medical associations here in the state of Florida, and we're really pleased to have this opportunity to give you the headlines from this week up in Tallahassee. And I'd like to welcome my partner in crime, Joe.
Fraser, yep, I'm Joe Daraskevich. Like we do every week, we kind of break down what's going on in Tallahassee. Just a little bit about me. I work along with Fraser at several societies around the state, and this is kind of fun. We get to give a little insight into what's going on over there at the Capitol. So, without further ado, you ready to get going, Fraser?
Yep, let's do it.
All right, the first topic, first headline we have this week, a couple of leadership priorities get sent to the governor with 2 weeks to spare. What are those leadership priorities, Fraser?
Yeah, one of them is an issue we haven't talked about at all in our weekly updates so far, but it definitely emerged as a priority for the Speaker of the House. And I guess I misspoke last week when I said the Live Healthy plan wasn't really attached to any horse trading that's going on. And I'm not sure there was any horse trading at all, but definitely both chambers now, their leaders have passed their priority bills for the year, and they kind of got done on the same day and sent to the governor. So on the House side, Speaker Renner's priority was protecting kids from the negative impacts of social media. So there's a ban on kids under 16 accessing social media that has been passed by both chambers now and sent to the governor's desk. There is some, actually, it's not rumblings. There was some public comments from the governor that he is uncertain about signing that bill. So we'll see if he actually puts his signature on that legislation or not. The major dividing line on the pros and cons on that bill is whether the legislature should step in and ban kids' access from social media, or should that be left to parents to handle, whether their kids should be accessing those tools or not. So we'll see how that emerges. But that was the Speaker of the House's major priority. And with that passing, of course, it paved the way for the Senate President's priority, the Live Healthy bill, which we've been talking a ton about, to pass the Florida House as well. So that bill has now been passed. They married up the language and it's been sent to the governor. A couple highlights on that. The final version of the bill does add $50 million in state funding to expand medical residency slots. So that's going to provide 500 new medical residency slots, which is fantastic in helping us deal with our workforce issues here in the state. It puts another $30 million into the FRAME program, which is loan forgiveness for physicians and other healthcare practitioners, dentists, to get loan forgiveness here and encourage more of them to come to the state and practice. It does invest quite a bit of money in mobile response teams for behavioral health issues, which is great to try and address the mental health issues we have here in the state. There's additional $135 million for hospital Medicaid reimbursement to help support moms and babies, which is terrific to see that investment in our future as well. And then one of the things we'll kind of follow over the coming years is it creates this Health Innovation Council, which is a 15-member council that's going to kind of like a Shark Tank type deal. They're going to take presentation technology to improve workflow in healthcare delivery. So that'll be kind of interesting to see. They have $50 million in funding that they can give to these folks that come up with creative ideas to improve efficiency and outcomes in healthcare. So all in all, a huge investment in the health of our state that's coming out of that bill. There will be some things we need to address over the long term. It's a 300-page bill. So any train legislation that big, you're going to have some issues that need cleaning up down the line, but overall a net positive for the state and something that we are glad to see on its way to the governor.
And just to bring back up that horse trading, that was something that you were kind of shocked about last week, and that's a pretty common thing to happen. So it is interesting to hear there was a little bit of that back and forth with that major legislation.
Yeah,
But
and I think this year wasn't really horse trading as much as it was let's give each other, speaking of the Senate President and the Speaker of the House, let's give each other our major priorities here at the same time, and we can both kind of champion these things that we've done for the state, leaving our legacy on the future of Florida. So it's very cool to see both of them pass and head to the governor.
Yep, and clearly some pretty top priorities up there in Tallahassee. All right, moving on to the second topic today. Proposed increases in sovereign immunity limits may have life after all. What's that life about?
Yeah, so we thought the legislation was dead because it wasn't moving anywhere in the Senate. Well, it moved through its first committee, but had stalled out a bit, and then the House failed to bring it up again over on their side. But in a late push over on the Senate side this week, it got brought up in its second committee of reference, and they've already put it on the agenda for the third committee next week. So we've been monitoring this bill, excuse me, primarily because the impact on public institutions. So sovereign immunity is a cap that injured parties can get in compensation if a government entity harms them. So it impacts our public hospitals that are run like up in Jacksonville, for instance, UF Jacks, and all your major, government um, hospitals in the state. So they've always had an immunity cap at $200,000. Not always, but it hasn't increased in many years. So the bill this year would double that cap to 400,000. So you do have some concerns if it does pass, like what that additional liability exposure is going to do for funding for those institutions that usually have very fine margins. From a medical association standpoint, obviously we have a lot of doctors that work in those institutions as well that may be impacted around funding. Um, and compensation and access to resources and supplies and workforce and all that stuff. So we are monitoring that. It still has a long way to go, but I did want to highlight it because I know it's a priority for a lot of our members and physician leaders that work in those institutions. So I wanted to flag it for everybody.
I know up here in Jacksonville, there are a lot of physicians that are keeping a close eye on that. So we'll do the same. We'll keep an eye on it, and any major movement in that, we'll definitely bring that to the table. Moving on to the third headline this week: how far will the legislature move the needle for injured workers, Fraser?
Yeah, so that bill, the great news this week is it's passed its final committee in the House. So now both chambers have moved it all the way through the committee process. It is ready for action on the floor of both. The bills are pretty different in the two chambers. So the Senate version of the bill by Senator Bradley increases reimbursement to 200% of Medicare. And that's the bill that Organized Medicine prefers. The House version increases reimbursement to 150% of Medicare. So current reimbursement in the system is 110% of Medicare for non-surgical codes and 140% of Medicare for surgical codes. So by only going, if the ultimately if the House prevails at their level of 150 of Medicare, we don't think it's going to move the needle very far because for especially for surgical specialists, just because going from 140 to 150 of Medicare isn't really going to drive a ton of physicians back into the workers' comp system. Whereas the Senate version would increase it again to 200% of Medicare. So it would make sure that access to surgical services as well as non-surgical really get a boost if this bill is passed. The good news is in both chambers, there's been wide acknowledgement that that physician reimbursement in workers' comp needs to be increased. To give you an example, an example actually that the bill sponsor over on the House side has used Dan Daly a couple times, and to do a surgical fixation of a distal radius fracture. So we had one of our surgeons from Tallahassee Orthopedic Clinic testify. He has practices both in Georgia and Florida. Currently in Florida, that reimbursement to fix that distal radius fracture is $602. Up in Georgia, currently he gets paid $1,311. So huge difference. If the House prevails on their bill, only bumping it to 150, that reimbursement would only move from $602 to $645. So again, it doesn't move the needle much. The Senate version would move it to $860. Again, not going crazy, so we're not like jumping over Georgia and really extending the state further than what's common in our neighboring states. And because of that, we think the Senate version really would do the trick as far as encouraging more doctors to come back into the system.
Yeah, wow, that just that example that you shared right there, that's amazing. Just going over state lines and hearing that, that's just a good example for any physician across the state that lawmakers need to hear these anecdotal stories of hey, when I'm practicing just over the border, I'm getting this much more money, and it kind of makes it feel that much more real. So appreciate that insight on the testimony over there.
Yeah, and we'll see how that.
So those are our three top. Any more there, Fraser, on that topic?
Yeah, I was just going to say, since both chambers, since the language is different in both chambers, we're now going to have to negotiate what that finally looks like. And of course, we'll be pushing hard for the Senate version and make the case that since there's broad acceptance that something major needs to be done, let's actually take this opportunity to really expand access and go with the Senate version.
And it might as well make a splash and make something that'll really make a difference across the state. Well, so I flagged a few other things that maybe we can talk about. Maybe not quite to the level of our three headlines. Advancing innovation, biomarker testing coverage in Medicaid. We've got a little update on that, Fraser. You want to go into that a little bit?
Yeah, that bill has passed both chambers as well and is going to the governor. It would make sure some of this new technology around biomarker testing is available for Medicaid beneficiaries. So it's looks like it's focused just on cancer treatments, but it's great to see that again the state's going to invest in the Medicaid program and make sure those beneficiaries have access to this biomarker testing. The emergence of biomarkers, of course, is part of that precision health movement and really trying to make sure that we use the right medications on the right patients that are going to be effective. So it's great to see that bill moving forward, and certainly we support it.
And I know that was something that was brought up before the session even started. A lot of talk within our organizations about those biomarkers. So good to get that update. And then one last thing, bringing up the rear, Brazilian butt lift bill is back before the governor. What's the latest with that?
Yeah, what would be a legislative session without talking about Brazilian butt lifts, right?
Right.
No, in all kidding, it's been a stain on the state of Florida for a number of years, particularly in South Florida, the number of deaths and injuries that are coming out of some of the procedures being done down there in office surgery locations. So legislation's been passed the last couple of years trying to provide some regulation to what's going on in those centers. Again, not to pick on South Florida, but it happens to be more prevalent down there than elsewhere. So this is another bill that will again take measures to rein in some of the unsafe practices that are going on in those centers. So again, we certainly support this legislation as a means of protecting patients and addressing something that continues to give medicine a black eye down there when those folks are acting inappropriately or in unsafe manner. So we're again happy to see that move forward as well.
That is a serious topic and something that is focused on quite a bit down there in South Florida. All right, Fraser. Well, that's another good recap. Obviously, we'll be doing this again next week. Any last thoughts before we go?
No, 2 weeks to go a session. Next time they're going to focus a lot on the budget next week, the overall budget. So we'll probably have some thoughts on that for you too. And don't worry, I know we're coming to the end of session, and people are going to be like, "What am I going to do without hearing from Joe and Fraser every week?" We're working up a plan to keep going throughout session, and I think the thought process is to invite, as we get into election season, start to invite some candidates that are running for office onto our program and get a little get to know you session with some of those folks and maybe do a little remote fundraising as well. So we have ideas to keep this going, Joe. Want to make sure you're not going to be out of a job in a couple weeks.
That's good. Yeah, I need this. I need this to be year round. So I'll be here for any needs that we have. But again, this is a great recap. We've covered a lot of big topics and some other ones that weren't so big for the whole state. But they, I know some of our physicians in specific regions were concerned about those last things we brought up. So I'm glad we touched on those. But again, I'll see you next week, Fraser.
Yep. Have a great weekend.